Well, it's going to be a very personal view. I'm not sure how many of my colleagues would share that, but you know, psychiatry really has still its roots in mental hospitals, loony bins over a century ago, and a lot of thinking, particularly the diagnostic thinking, is based in what's been happening 100 years ago in the hospitals, where you really started classifying the types of the problems by the subjective experiences and a little bit of behavior issues. But that's, of course, why I'm so interested also in the nature of consciousness, because psychiatry essentially is based on 99% of the subjective experiences that are reported by the people. And that's served us up to a point, but when it's established, it happened about 1980s, into a diagnostic system that's based on essentially subjective experiences, that becomes very limiting, because you can create categories, but categories based on just subjective experiences don't have much value in assessing what really is wrong, what needs to be helped. Doesn't tell you much about the prognosis, the future of the person based on the problems, and does not tell you really anything about what needs to be done to help people. You really need to look at the whole profile of the person. You really need, besides the subjective experiences, you really need to understand the psychological development from childhood, how the subjective experiences changed over time, their dynamics, their interrelationships, where people live, family history, medical situation. Then I think you can really help quite effectively. Otherwise, the psychiatry becomes kind of a trial and error. And that's unfortunate and unnecessary. So unfortunately, what it led to is that majority of psychiatry at this point is you come for 10 or 15 minutes, you get the subjective experiences and you prescribe medication on the assumption that this is all just some chemical imbalance in most situations. And while that is part of the story, that's not the solution. Fortunate for the patients is, of course, that brain is a wonderful system, complex system that self-heals. So many people survive this kind of care, but there is a fair proportion of people for whom that's not help. And so when I see patients, difficult patients, particularly referred from not just GPs, but from other psychiatrists, where they feel that the treatment is failed and they want to know what else could be done, you really have to assess the whole situation. And the frustrating part is, and that's the critique of the contemporary psychiatry, is that the solution is they see patient for a short period of time and prescribe medication. Of course, just based on subjective experiences, it most likely won't work, so they add another medication. And if that doesn't work, another medication. And so I sometimes see people coming on 9 or 10 different medications, and the question often that comes from psychiatry is, what is the next medication I should add? And I say, no, the question is, what's wrong? Assess it. So I hope that this is gonna change. And I think there are indications that it will change. That the last discussion about the last diagnostic system, which is DSM-5, I think large proportion of, well, there was many psychiatrists who would say, well, let's just tinkle with that and improve it, but that's not going to resolve the issue. And I think many people realize that has to be changed. So we need a new paradigm, and certainly understanding the nature of consciousness would be a very good change in that respect. Where do the subjective experiences actually come from? And there is a lot to suggest that the brain is just not sufficient explanation for the complex situation. What else I can? And the change is critical. I mean, over the past couple decades already, the statistics from the World Health Organization show very clearly that there is an increase in subjective suffering through depression, anxiety, drug abuse, alcoholism. And this is particularly painful with young people, with young generation. We've followed children and grandchildren of our patients now for almost 30 years, and you can see the increase of this stress. So change in the approach to these issues is really a pressing need. The observations are from our own practice, but there are epidemiological statistics. There have been released recent epidemiological statistics from Canada, and particularly from the United States. And in the first year, for example, university students, up to 40% have emotional problems that are at the level that if they are seen by a physician, he will diagnose them with psychiatric problems. They're going to get diagnosis, they're going to get label. 12, 13, 14% of the kids have been seriously suicidal. It's a problem. It's a situation. We can only speculate from it comes from. Clearly, it got worse with the pandemic, the feelings of isolation. I think that's a big issue, feeling of isolation, feeling of being disconnected from other children, other society, focusing sometimes just on technology and sitting with the iPhone and not really connecting with the people, with the kids who are sitting right next to you. But there are other factors. You can see that these children are biologically somewhat different. One example would be girls, for example, start maturing much sooner. We see girls who start menstruating at 11, 10, 9 even. You know, there's a biological factor in that as well. And there may be something happening in collective consciousness that plays a role. But I think that a short answer is, I don't know. I think it's a complex reason behind that, and we're going to have to try to decipher that. I think the reason why I think my perspective is somewhat different from many of my colleagues is that I've just had opportunity to follow patients, people up to 55 years. We've followed very large families over a long period of time, and this long-term and deeper perspective gives you different views. And one of the conclusions is that when somebody has emotional difficulties, there really can be different sources. Very often they are psychosocial, stresses, difficulties in the world as they are. But there are also biological factors. There can be genetic factors, and there are also issues of transpersonal, the values people have. If you do not feel somehow anchored in the world, if you feel that your mind is on the loose, that by itself can be a difficult problem. So I think when it comes to finding out what needs to be done when a person has difficulty, I think it's really, first of all, figuring out which of these factors play a role. And it depends. I mean, there are conditions where there are medications can be treatment. It's a minority of issues, but there are situations where you can have a severe mood disorder and medication may be enough to help the fine-tuning in the system, and people come and you say, okay, now let's look what's behind that. And they say, thank you, I don't want to look, I'm fine, I'm functioning, don't touch that. But that's one extreme. Usually you have to, if you use any medication, you have to have psychological support along with that. And often the psychological approach is the main stream that needs to be looked at. And then there is an area, and I've published some of the things on YouTube, where actually all these approaches fail, and you may find that the issues are deeper. They may be related to what happened in birth, what happened in the womb, or sometimes it's transpersonal situations. It's something that are tied up with consciousness, quite deeper in the consciousness, and you have to find psychological approaches that reach that. Sometimes most psychiatry is based on suppressing the symptoms. And in this situation, the problems are there. You actually have to activate the mind. You have to activate the consciousness and get to it and release whatever strangulated energies are there before people get well. Yeah, you can use hypnosis. We've used, of course, holotropic breath work very successfully for during the years where we didn't have access to psychedelics. Now, I think psychedelics are certainly where we've been using particularly ketamine, because that's it's available in general medicine for anesthesia, but you do not get into trouble usually if you use it in psychiatry, because it's in the pharmacy available. And now slowly, gradually, other psychedelic drugs are available. I think by the fall, or latest by next spring, I think MDMA is going to be available, first for post-traumatic disorders, but once you have it available legally, I'm sure it's going to be used for, and it's helpful in other situations. And psilocybin, I think it's probably coming next. The issue is going to be to learn to use it appropriately, and that's a big issue. And we're trying focus now to develop some rules, guidelines, systems that will appreciate that the psychedelics really are helpful as a support to psychological approach. It's not the psychedelics that heal, but it can happen. Some people are lucky and may have just dramatic improvement, recovery with a psychedelic session, but the dangers of that are too huge, and I think it's important to use it properly. Proper preparation You know, I essentially have been using them only with people where we already established good relationship. I had a good understanding of their clinical profile. And then the critical issue seems to be the integration of the session, whatever comes in the session, to get understanding of what has happened. And often for that you need to have understand the expanded maps of consciousness, all the way to metaphysical and mystical experiences, so that people are not frightened by those situations. They realize that it's a part of normal consciousness. It's under certain circumstances. And of course the integration of those experiences is essential. So, and there is unfortunately quite a bit of misuse of psychedelics. It's coming up with the legalization. You know, the part of the problem is there are shadow sides to it. As soon as it became obvious that psychedelics are going to be used, 25 new pharmacological companies emerged, for good reasons, but also for smelling the money behind that. And so we're going to have, it's going to be a balancing act to get to the point where these substances are used appropriately. My answer would be definitely. I mean, that's I think what we've been talking about here, at the presentation. And the big issue is that too many people are still unwilling to look at the evidence that shows that there is more to mind than just the brain. The brain is an important part of it, but that's certainly only part of the story, particularly when it comes to experiences. I think the observations supporting that are huge, huge. I think at this meeting, what I try to focus on are only those areas that are experimentally well documented, because I think that's most valuable. Because I see as part of my task is to bring these things to my colleagues who are not open to this, creating a bridge. Yeah. Because I've been extremely lucky experiencing both the best in ordinary consciousness and a lot of learning in non-ordinary states of consciousness. But I think if you want to show people that there are these non-ordinary states and transpersonal states, I think it's best to start with the areas where there is good, solid evidence. So, for example, the near-death experiences. You know, it's a huge area, but the experiences that happen when people are clinically dead and experience out-of-the-body situations that can be demonstrated by verified by other people, number of other observers. I think that's undeniable. There is much more learning in near-death experiences, but those are anecdotal things and can be debated. But the veridicity of these out-of-body experiences, that can be tested, and it's very well documented in the literature. There is, if one is willing to look at psychic phenomena, the statistical evidence is huge for telepathy and number of other factors. But for me, you really just need one well-documented observation that shows that the brain is not enough. And in the psychic experiences, for example, to me, it's the remote viewing that it's unusual, not because of some brilliant ideas that people had, just because there was a political will to investigate it, and therefore there was money to investigate remote viewing in the Stanford Research Institute. And then when you look at the results, you know, when you have effect size of 0.65, you know, that's huge. That's 5 to 10 times of the kind of evidence that one requires when we require in traditional medicine. And we are willing to prescribe medications to millions of people that are based on much lower strength of evidence. When you look at the importance of body, which is not only connected with brain, but there are elements of its own consciousness, then I think those are the areas that help us to move forward. I think if we want to understand the transpersonal and make it available to other people to investigate, it's best to start with those areas that are really very strictly experimentally documented. There is much more, and much more will come, but I think that's the way to start. You know, I'm just delighted to come to Pari because I had the pleasure to spend some time, few years, with David Peat and some short period of time with David Bohm, and I see that you are really materializing his vision and his dreams, and that's a center that, using smaller gatherings, explores the present and explores the visions for the future. Specifically for young people, I feel that they need to be open to two things. One is looking for their own path, their own, not to assume that they have to fit into the past jobs and past avenues that have been followed. Look for their own, because there's so much opening. And the other thing is, there's obviously a lot of distress, and there is not going to be enough help in the existing situations. They need to look for the ways where they can contribute to their own help. And there's, for example, as we've learned, there is so much interconnectedness among people at a deeper level. This is something that's now documented in quantum physics and the interconnectedness is actually documented in all hard sciences: quantum physics, astronomy, geology, chemistry. And that interconnectedness can be utilized by young people by creating groups, helping each other, supporting each other at that level, even remotely, because of the interconnectedness. And that's I've seen that when young people create that kind of things, they never feel alone, they never feel isolated. And that's very important, because I think those are some of the sources of the pain and distress and anxiety and depression that they are now experiencing. But I think they have to look for these new, and we certainly will try to help them with that. But they should not assume that the help is just going to come only from outside. It's frightening. I mean, I know even in well supplied, well financed situations like Canada, there is, when a young person is in distress, there's a year waiting list, to be seen. That's not even starting treatment. So this is not a solution. I think some of the solutions, young people have to be involved in the development, and there are means in the interconnectedness. Absolutely.
Thank you very much.
Absolutely. It's a great learning. It's one thing is the meeting, and it's wonderful, but the other I would call para-meeting. There's a lot of happens just by meeting people, discussing things outside of the meeting and establishing relationships and friendships.
Thank you very much.
Thank you too.